Hi, I'm Dr. Natalie Braun, and I am an obstetrician gynecologist here at Olmsted Medical Center. As an obstetrician gynecologist, part of my practice involves caring for women at various stages of life. So starting from just annual wellness exams with cervical cancer screening, ordering breast cancer screening or mammograms, seeing patients during their pregnancies for obstetrics care, also seeing patients for fertility or infertility concerns, or if they're having difficulties with their menstrual cycles, or even after menopause, if they're having issues with hot flashes or bleeding or abnormal discharges, things of that nature. Those would all be reasons for patients to come see me. One area of special interest of mine is natural family planning. So trying to empower women to take control of their own fertility and fertility needs without the use of artificial hormones. I became an obstetrician gynecologist because I just love caring for women, and it offered a really wide variety in ways to help women. So following them throughout their adult life, through having pregnancies and delivering babies and helping bring new life into the world, all the way till after menopause. And it just really fascinated me and seemed like a great way to help and serve women. When patients come to see me for an appointment, I would like them to know ahead of time to, one, just try not to be afraid, try not to be too anxious about it. I feel like pelvic exams, seeing the gynecologist in particular, can be very anxiety provoking, and that is not what we try to convey at that first appointment. We really want patients to be comfortable. We want to empower women to meet their health needs. I do feel like women in particular put others first, right? And are constantly taking care of their husband, their partners, their spouses, their children ahead of themselves. So I think that they should know that we really want them to put their healthcare first, and it's important. And rather than living with things that can be a nuisance or a bother, such as, really heavy menstrual periods, come and see us, and we want to help in any way that we can. Some of the procedures that we provide in the clinic would include management or further diagnostic evaluation for abnormal or irregular bleeding, such as hysteroscopy, further workup and evaluation or treatment of abnormal pap smears, including colposcopies or leaf biopsies, and further workup or management of fertility or infertility issues. I feel like it's important for patients to develop good connections with their healthcare providers, but particularly in obstetrics and gynecology, because it is such a sensitive field of medicine. And patients have very different and very personal beliefs and wants and desires and needs for this area. So finding that provider that kind of sees eye to eye with the patient and working as a team is very beneficial to their healthcare overall. When I'm outside of work, I have 4 little boys, ages 1 to 9. So I'm frequently running after them or taking them to different activities. I also have 2 dogs, a mini schnauzer and a golden doodle. So we love taking them for walks, going to the park. Fishing is a favorite hobby of the family. So we like enjoying nature and the outdoors in any way we can. I love coming to work every morning to see my patients. I love the smiles on their faces, and sometimes there's not smiles, right? Sometimes we have a lot of difficult moments, but I like being there with them. I enjoy taking the journey with them and being their support system. I love serving them. I also love helping my colleagues and having them help me at times, right? It's a team, and I know that they've got my back and I try and have their back. So it's a great environment to come to work in every day, and I always look forward to it. It's a new adventure.